name is Kaushik, and I'm going to be talking today about Telederm Outreach. It's a global humanitarian dermatology telemedicine company, but we'll dig into that a little bit later. And if any of you guys want to know a little bit more information, it's teledermoutreach.org. So to give a brief background about what this problem might be, first of all, there is developing nations that we see by this graph right here. So in red, the countries in red are afflicted by skin diseases more, whereas the countries in the bluish, purplish end of the rainbow are affected by skin diseases less. And obviously it also depends on where the equator line falls and whatnot. But we see that there are a variety and a plurality of skin conditions are in developing nations as compared to developed nations. And skin disease, just to put it in perspective, is the fourth leading cause of disability worldwide if you exclude mortality, and it accounts for around 2% of the global disease burden. The problem really lies in that there is this unequal distribution of skin disease, but more importantly, there also is an unequal distribution of the dermatologists and the access to dermatology care. So to put it in perspective, I just chose the US and India as one example. Even the US has its own shortages of dermatologists, but they have around 3 dermatologists for every 100,000 people, whereas India has around 0.5 dermatologists for every 100,000 people. To put that in perspective, that's 9,000 dermatologists in our country of around 350 million versus 6,000 dermatologists for a country of 1.3 billion. The primary issue that patients face here, apart from the lack of dermatologists or the disparity of dermatologists, is that patients are really unable to travel sometimes they need to take days off of work, sometimes there are just no dermatologists around at all, and they might need to travel very long distances, or they might not have the resources to travel these long distances to see these specialists. The graph in the bottom right, if any of you are interested, is just to look at again, the red is where there's a lack of dermatology care. Specifically, there is a paucity of dermatologists proportional to the population, versus green, which is where there's an okay number of dermatologists for the population. And you can see if you flip between the two graphs that they kind of coincide in the same way, such that there's a lack of dermatologists where there are more skin diseases as well, which is not a causative relationship in any way, but it's just to show that the problem compounds on itself, where there are a lack of dermatologists and there are more skin disease issues. So the general issue with this in mind of our organization here is to equalize care regardless of where you're from, what your socioeconomic status is, and ultimately the way that we do this is we provide advice to referring local physicians in developing nations who are serving in under-resourced communities. Our target here is general practitioners or health systems serving underserved populations in these developing low-resourced areas. And the key here is that we're providing advice, not a prescription, because obviously medical licenses do not carry across borders. So the best we can do is to ensure that these general practitioners have insights from dermatologists here in the US and Canada to provide, to give them some advice about treatments and diagnosis. So there are a few different alternatives about how people have been thinking about bringing dermatology care and any care to underserved, under-resourced areas around the world. The first is mission trips. So medical mission trips are common. You've probably heard about it in the media, but the issue is that they're costly and they're transient. They're not a sustainable solution because the plane tickets are expensive and they're only there for a week or two, so it really becomes a problem in terms of sustaining that relationship. The second is real-time telemedicine, which is, some of you may have used this is a little bit more mainstream, especially in primary care, is basically the way that I like to explain it is FaceTiming the doctors. So when you FaceTime the doctor, there might be a general practitioner there, the specialist will be on the FaceTime call, and then they'll give you a diagnosis and treatment. But again, the issue lies in that there's a scheduling issue, especially if you're trying to schedule a FaceTime call with someone on the other side of the world, so the hours don't align, and then also in some of these low-resourced areas, they lack the broadband to support a live stream. The last is stored-and-forward medicine, which is what we're targeting here today, which is a separation of both space and time. So they take a picture of the manifestation and then they upload it to a cloud where the specialist can log on and then provide the advice or diagnosis that they need to provide. The nice part here is that it doesn't always apply to all specialties, but specifically dermatology, radiology, and ophthalmology are particularly conducive towards conveying information in a single 2D image, so they're able to capitalize on store and forward, whereas other specialties are not. So the research does show that, it's a brief list, but the research shows that teledermatology and store and forward technology, most of the research has been conducted here in the US and in Canada, is reliable and effective, and a lot of patients are very happy with the results here in Canada and the US. The strategic partner that we have aligned ourselves with to provide this store and forward technology is Telederm Inc., which was formed in Canada, and it's the largest teledermatology service up there, and they provide hundreds of thousands of patient cases per year and consultations per year, and they were willing to carve out a niche of their ecosystem for our nonprofits as well. So a brief demonstration, basically the referring physician meaning the general practitioner, will post all of this information, the patient history, the duration of the problem, any current treatment, past treatment, all that information that's relevant for the specialist to see, as well as a brief image for the dermatologist to look at as well. Based on that, the dermatologist can then provide a e-consultation, which will have the proposed treatment and have the proposed diagnosis as well, advice on those things. Obviously, this is not legally binding, but it provides the general practitioner somewhere to start. So just where we are right now in terms of partners, this is really a partnership-run organization because we need local partners, we need institutional partners, and we need global partners. So our global partners, we partnered with Canadian Physicians Aid and Relief, as well as the World Telehealth Initiative, which is another telehealth real-time nonprofit, and we're working to expand our network and find the clients that might benefit from our services. Our institutional partners are really where our providers or our our consulted specialists, dermatologists come from. So a couple examples up here are dermatology residency programs who can implement it into their training, such as GW's residency, George Washington up in DC, or dermatology societies like the Skin of Color Society, which has around 400 to 500 dermatologists as well. And these are all people that we are currently in the talks with to bring this dream to a reality. And then finally is our local partners, which are local practitioners, local health systems who are serving in these low-resourced, underserved areas and want to be able to implement this care in their